Hello everyone, I am student nurse Angelica Contreras from BSN1-11C Group 10, and today I will conduct my return demonstration on abdomen assessment. We do this in order to understand how complications in the abdomen area can be seen, heard, and felt. So first is we're going to review the client's previous medical records and doctor's order sheet if available, which will give us insight or a background of what is the current situation and condition of the patient. Okay, next is we're going to determine the scope of the assessment, which in our case is assessing the abdomen. This is to know what are the procedures that we need to perform and to know what are the equipment that we will be needing. So this equipment includes gloves, stethoscope, small pillow, measuring tape, wristwatch with second hand, centimeter ruler, drape, pen light, marking pen, tongue depressor, examination gown, and examination table. And lastly, before we meet our patient or client, we need to perform hand washing or hand hygiene to deter the spreading of microorganisms and don gloves if needed. Now for the introductory phase, first is we're going to greet the client with politeness and respect. We are also going to identify the patient's identity, and this includes establishing rapport as well. Next is we're going to explain the procedure properly to the client, including how they can participate and a chance for them to raise their concerns, so they will be aware of the things you will make him or her do and make them feel comfortable with it so they can gladly cooperate with us. We also have to ensure the client's comfort, privacy, and confidentiality for their dignity and safety during the assessment. This includes stripping the patient's body as needed and only expose the part that you will be examining. Lastly is we're going to ask the client as well to empty their bladder to avoid distraction during the assessment, since there might be chances that will trigger urination in the middle of it. So now we're going to meet the client. Good morning, ma'am.
Good morning.
How are you today?
I'm fine, thank you.
Oh, that's good to hear. By the way, I am Angelica Contreras. You can call me Jel. And for today, I'm gonna be your student nurse. Do you understand?
Yes.
Can I check your wristband? Can you please state your first and last name to me?
Danica Daya,
And your date of birth?
December 31, 2002.
Okay. Thank you. And how would you like me to call you?
You can just call me Faye.
Okay, nice to meet you, Miss Faye. Is anyone else with you right now?
I'm currently alone, but I think my mom will pick me up later.
Oh, that's so sweet. Anyway, do you know why we're here today?
I think I'll be having a checkup in my tummy area.
Yes, that's right, Miss Faye. So, I'm gonna be checking your abdomen. So, during the assessment, doing this assessment, I will ask you to wear the patient's gown so that I can easily examine your tummy area. Is that alright with you?
Yes, po.
And also, this will involve me touching some of your body parts. Is that okay?
Yes, it's okay.
Okay, so that's good to hear. Thank you. Before we proceed though, is it alright if I close the door for it to provide us some privacy and avoid for any distractions?
Yes, please.
Okay. So, let me assure you that everything we have talked here and every information that will be gathered is confidential between me, you, and the other healthcare professional that would also take care of you, okay? If you have any concerns, questions, or clarification, don't be shy to raise it, okay?
Okay.
So, before we start, can you please urinate to empty your bladder?
I've actually done that before I came.
Oh, that's good. So, do you have any concerns before we proceed?
None so far.
Okay, so can you please change?
Thank you.
Now, before we start with our working phase, we need to make sure that we have already gathered subjective data from the patient before continuing. This is to give us insights about the situation of the patient. This will help us identify what to assess last, since it is very important to assess plus the areas where the patient feels the pain or where the pain is present. In our case today, we will assume that the patient does not feel any pain yet. Next is we're going to position the patient in a supine position to have a clear view of the abdomen, and then make sure to cover the upper and lower parts of the patient this with the bed sheet, leaving only the abdomen part exposed to preserve the client's privacy and dignity. We need to keep in mind that we will follow the inspection, auscultation, percussion, and palpation for our abdomen assessment to avoid disrupting the bowel sound during the auscultation. So, I'm going to lower the bedsheet, okay? Miss Faye, I'm going to expose your tummy. Next is we will start with the assessment by first observing the abdominal skin. This will help us identify if there are any abnormalities in the client's skin appearance that may be indicative of complications. To do that, we need to note for any vascularity, striae, scars, lesions, rashes, and even the history of scars, and document its location by quadrant and reference line. We are also going to include for any abnormal findings, such as the presence of edema, lesions, especially vascular lesions, and any discolorations. Okay. Next is we will start with the assessment by first observing the abdominal skin. This will help us identify if there are any abnormalities in the client's skin appearance that may be indicative of complications. To do that, we need to note for any vascularity, striae, scars, lesions, rashes, and even the history of scars, and document its location by quadrant and reference line. We are also going to include for any abnormal findings, such as the presence of edema, lesions, especially vascular lesions, and any discolorations. Okay. So, along with that, we will also inspect the umbilicus color, contour, and location since it is our center of balance. Abnormal findings may include the Cullen sign or a bluish discoloration around the umbilicus, deviated umbilicus, and everted umbilicus in abdominal distension. Okay. So we are also going to inspect for contour as well to know if the abdominal wall is weakening while the patient is lying by. Sitting beside them, look across the abdomen at a level slightly higher than the abdomen. Abnormal findings may include distension due to obesity, gas, or fluid accumulation. So, okay. So, however, if there is a presence of distension, we will have to inspect and measure abdominal girth. Distension may depend on its location, like if it's below the umbilicus, it may be because of full bladder, uterine enlargement, or an ovarian tumor or cyst. If it's above, it's connected to pancreas or gastric dilation. Okay. So to measure for abdominal girth, we need to make sure that the client has emptied out their bladder and still on a supine position. head may be slightly elevated. So, in measuring it, we need to use a tape measure and place it behind the client and use the umbilicus as the starting point. We're going to use centimeter as a unit because it is most commonly used to measure. We're going to keep in mind that it's better to do this constantly at the same time of the day. We need to mark the measuring site with a ballpoint and ask our patient not to wash it until it is no longer needed. So, my patient right now doesn't have any abdominal girth, so there is nothing to be measured. So, we will also check for the symmetry to determine hernia or diastasis by raising the patient's head. We will inspect her abdominal movements like respiratory movement, aortic pulsations, and peristaltic waves. Miss Faye, can you please lift your head?
This?
Yes, wait for a while. Okay, thank you. Now that we are done with inspection, we will proceed with auscultation. Here, we will first auscultate for vowel sounds by using the diaphragm of the stethoscope, making sure that it is warm and working. So we're going to listen for each quadrant for about 1 minute each, starting at the right lower quadrant and move your way clockwise. So abnormal findings include absent vowel sounds, hypo and hyperactive sounds. So we're going to listen now. Okay. Now we will use the bell of the stethoscope to listen for vascular sounds. Take note for bruits, low pitch, murmur-like sounds on the aorta, the renal, the iliac, and the femoral arteries. Okay, thank you, Miss Faye. Other than brute sounds, we will determine as well for venous hum in the epigastric area and umbilical areas. So the presence of brute and venous hum sounds may indicate abnormalities. Okay. Now we will use again the diaphragm of our stethoscope to detect friction rubs over the liver and the spleen, or at the right and left lower rib cage. So friction rubs at the lower right costal area is associated with hepatic abscesses or metastasis, and the anterior axillary line is associated with splenic infarction or abscess, infection, or tumor. Thank you, Ms. Faye. We are done with inspection and auscultation now, so we will proceed with percussion. We will follow the percussion technique clockwise, starting from the right lower quadrant. We should hear tympanic with dullness over the liver and spleen. Okay. Now we will estimate the liver size by percussing its lower and upper border. We will start in the right lower quadrant, mid-clavicular line, working our way upward, noting the change from tympani to dullness. And if dullness is determined, we are going to mark it. So we're going to use a ruler to measure the distance. Okay. Okay, so once we mark the liver border of dullness, we'll observe the descent of the lower border of liver dullness below the costal margin. So we're going to perform percussion and ask the client to exhale afterwards. Miss Faye, can you please hold your breath? Okay, thank you. Then we're going to measure it with its costal margin. Okay. We will now percuss the spleen to estimate its size by first assisting the patient to turn to the right side so we can percuss on the posterior to the left mid-axillary line downward and note the change from lung resonance to splenic dullness and flex their knee as well. Other than that, we can also perform another method by asking the patient to take a deep breath and percuss on the last left interspace of the anterior axillary line. Miss Faye, can you please turn on this side? Okay, thank you. Can you please hold your breath? Okay, thank you. Okay, you can now turn back. Now we will bluntly percuss the liver by placing our left hand against the lower right anterior of the ribcage and use the ulnar side of the hand to strike the left hand and note for any tenderness. Miss Faye, tell me if you feel any pain, okay?
Okay.
So, do you feel any?
No.
Okay, thank you. So now we're going to do the same procedure for blunt percussion and kidneys. However, first is we're going to assist the client in a sitting position and place the left hand at the costovertebral angle over the 12th rib. This is also called the kidney punch. On these blunt percussions, the patient must have no tenderness elicited. Miss Faye, can you please sit down? Okay, thank you. Please face there. Tell me if you feel any pain, okay? Okay. And the other side, for a while.
No.
Okay, thank you. So now we will test for shifting dullness by percussing the flanks from the bed upward toward the umbilicus, noting the change from dullness to tympany and mark it. So I'm going to examine it clinically. Now we're going to reposition the client to a side-lying position and percuss the abdomen from bed upward, noting the change from dullness to tympany. The presence of movable dullness associated with changing of position indicates ascites. Can you face on that side? This side, please. Okay, thank you, Ms. Ray. So to detect ascites, we can do the fluid wave test where we ask the client to place the ulnar side of their hand and the lateral side of the forearm firmly along the midline of the abdomen. We will then place our hand on the side to tap the opposite side of the abdominal wall. And note for any fluid movement, but there shouldn't be in order to have a negative result. Miss Faye, can you please place your hand here like that? And like that, press it a little bit. So, okay, thank you. So now we will continue with the last assessment, which is palpation to detect tenderness, mass, bulges, and swelling. So we're going to assist the client back to a supine position, only leaving the abdomen area exposed. So we are going to begin non-tender abdominal quadrant by using the fingertips to compress the quadrant to a depth of about 1 centimeter and do this to all quadrants. While doing so, we are going to palpate for masses as well on all quadrant, noting for its size, location, shape, consistency, demarcation, pulsality, tenderness, and mobility. And after that, we're going to use the palmar of the hand to compress quadrants to a max depth of 5 to 6 centimeter and note for any resistance or any deeper structures. And if resistance is felt or feel, we're going to perform by manual palpation. We need to always remember to palpate the umbilicus and its surrounding area as well for swelling, bulges, and masses. To palpate for the aorta, we're going to use the thumb and index finger to palpate the epigastrium slightly to the left midline for presence of abdominal aortic pulsation. Now we're going to palpate the liver. We're going to place the left hand under the client's back at the level of the 11th and 12th ribs, while the right hand is parallel to the right costal margin pointing to the client's head. Then we're going to ask the client to inhale, and while the client is inhaling, we're going to compress upward and inward with fingers and note for consistency and tenderness. Okay, I'm going to touch your back, okay, Miss Faye. Okay, can you please inhale? Okay, exhale. Inhale again. Okay, exhale. Thank you. Another way to palpate the liver is by hooking. So what are we going to be doing is we are going to curl the fingers of both hands over the edge of the right costal margin while the client is taking a deep breath. So we're going to gently but firmly pull inward and upward like a hook and note for consistency and tenderness. Okay, Miss Faye, please take a deep breath. Okay, thank you. Again. Okay, thank you. Next is we're going to test for cholecystitis by pressing the fingertips under the liver border at the right costal margin while the patient is inhaling deeply, and note for upper right quadrant pain and tenderness. Okay, Miss Faye, please take a deep breath. Do you feel any pain? Okay, take a deep breath again. Okay, thank you. Now we're going to palpate the spleen. There are two methods to palpate the spleen, but we will just do the first method wherein we stand on the right side and support with our left hand the posterior lower ribs. We're going to place the right hand below the left costal margin with the fingers pointing towards the client's head, and note for consistency and tenderness. Miss Faye, I'm going to put my hands below. Okay. Okay, please take a deep breath. And once more. Okay, thank you. Next is to palpate the kidneys. We're going to place the left hand below and the right hand on the right upper quadrant below the costal margin at the mid-clavicular line. And then we're going to ask the client to exhale and hold breath briefly. We're going to try to capture the kidney with the hands and slowly release the pressure. So Miss Faye, I'm going to put my hands below. Okay. So please take a deep breath, and when you exhale, please hold your breath, okay? Okay, so go. Okay. So take a deep breath. Exhale and hold your breath. Okay. So we will also do this on the other side. Okay, please take a deep breath. Exhale. Okay, again. Exhale. Okay, thank you. Next is to palpate the bladder. We're going to start from the symphysis pubis and work our way upward and outward to estimate bladder borders, noting for consistency and tenderness. Next is here are some series of tests we can perform. To perform hypersensitivity test to detect peritoneal irritation. We can use a tongue depressor to stroke the abdomen and note for complaints of pain or exaggeration. Miss Faye, I will stroke the tongue depressor in your abdomen and tell me if you feel any pain or anything. Okay. Thank you. Next is for Pessoa's sign to detect appendicitis. We're going to ask the client to lie on the left side and hyperextend the right leg and note for any pain. Miss Faye, can you please roll to your left side? Okay. Okay, then straight your legs. So what I'm going to be doing is I'm going to move back your right leg and tell me if you feel any pain, okay? Okay. So, this. Do you feel any pain? Yeah. Okay. Now you can go back. Okay. To still test for appendicitis, we're gonna do the obturator sign wherein we hold and support the client's knee and ankle to flex the hip and knee to rotate the leg internally and externally, noting for any pain. So Miss Faye, I'm going to hold your leg, okay? Then I'm going to rotate it internally. So tell me if you feel any pain, okay? Is there any pain? Okay. To still test for appendicitis, we're gonna do the obturator sign wherein we hold and support the client's knee and ankle to flex the hip and knee to rotate the leg internally and externally, noting for any pain. So Miss Faye, I'm going to hold your leg, okay? Then I'm going to rotate it internally. So tell me if you feel any pain, okay? Is there any pain? Okay. Lastly, test for appendicitis by rebound tenderness. We're going to palpate deeply at 90 degrees into the abdomen away from the painful or tender area. And then we're going to slowly release the pressure and note for any pain and change in the client's expression. And we can ask what hurt more, pressing in or releasing, or where the location of the pain is. Miss Faye, so I'm going to press your abdomen, then tell me which area is painful, okay? And also tell me if when I press it, it is painful, or when I release it, it is painful, okay? it hurt anywhere?
No.
Okay, thank you. Now you can wear your clothes again. So now for summary and closing phase, we are going to summarize everything that we have found or every findings or information that we have gathered during the assessment. We need to make sure that the client understand all all the results. And if not, we're going to let the client ask some questions or if the clients have any concerns or clarifications. After that, we are going to do an aftercare to the equipment that we have used. And most importantly, we need to do hand washing or hand hygiene after doing the assessment to deter the spreading of microorganisms and document everything that we have. Um, Miss Faye, so now we are done with the assessment and I'm going to summarize all, okay?
Okay.
So, based on our assessment, I did not note any abnormalities. Even your skin quality, appearance, and temperature were normal. Just some small bumps in your chest area. Can I ask, is that from heat rashes?
I think so, and from sweat as well.
Okay, I see. Well, about your lower body extremities, everything is also normal. Your heart rhythm is normal, and your heart rate is 98, which is also normal, and your BP is 110/86. So that's all I have today for this assessment. Do you have any questions or clarifications?
I think none.
Do you have any concerns regarding the results?
None.
Just a piece of advice, when you go out, do you have any sunblock?
I think I have some at home.
Okay, you can use it to protect yourself from the sun, or you can just use an umbrella case because nowadays the sun is very painful. So thank you so much for your full cooperation and for answering my questions. So I hope you have a good day.
Thank you.
Thank you.